Welcome to our podcast. Thanks for hopping on. We are going to get started here. And I'm going to get this.
Oh, I can. I'll do it.
We're going to start with, I don't know if they are on just yet. We are going to have a visitor talking to us about inpatient vaccines and our role and how well we can help in making sure that our patients are vaccinated. But I don't see them on yet, so we'll just start. If you'll just monitor for her name is going to be.
Is 2 in the minutes, Kathleen Mahoney?
Yeah.
Dr. Mahoney?
Yeah, Dr. Mahoney.
Okay.
And then I'll stop and they can.
What was their first name though?
Kathleen.
Okay.
That'd be helpful. Okay. Kim, just for awareness, you all can hear us, right? Cool.
Okay.
All right. And here we go. Okay. So just reminders, we start every staff meeting. Please remember for staff expectations that you're responsible for each staff meeting, whether it's being here virtually in person or reading the minutes or by watching it in Saba. So that is our expectation. And yes, the other expectation is that you're clocking in and out on the time clock on the unit that you are working on. Obviously, if you're working on 12, it's appropriate to be using that time clock. If you are working on 7100, you should be using that one. Non-appropriate ones are near the parking garage and on the second floor elevator. So just or on your phone. Please, I keep seeing this, no AirPods, even if you work night shift. I think you think you're being a little sneaky and you're not, because we randomly come in and then we see that you have the AirPods on. So please just, you can't hear alarms and be present with them on. So, and also limit your phone use on the unit. There's always something that can be done. And so it just is never a good look of professionalism when we have that. So please be cautious. One thing that's been coming up very frequently is about extra shifts of floating. This has really been affecting in some just like questioning with the PCTs. And I just think to make it easier for charge and all of staff to have this understanding is that anybody, whether you're a nurse or a PCT, when you pick up, you're going to be first to float. That's out of courtesy for the staff that are on that shift. Obviously, it stinks when you have 2 or 3 nurses or 2 or 3 PCTs pick up and then you're all of a sudden floating to another unit when, you know, you wouldn't have done that if they didn't pick up. I know it comes in 2 different folds and there's going to be a lot of feelings around this, but I think that this is the fair way to do this. And this will be the new expectation. So when you pick up extra, you're first to float. Okay.
Okay.
Yeah, you're going. I don't know though. Yeah, and then I'll keep.
I would say,
going with this.
I don't have that one in order. Do you want me to? I had the word.
Oh, you could do that.
Okay.
There.
Oh, perfect. Okay, great. Okay, kind of going quickly. Sorry, guys, we're moving. Okay, so there was a lot of discussion from the pulse survey to like regarding recognition. We were all kind of sad that there hasn't been a good tangible form to recognize like all of the things that we do kind of on the day-to-day, but like those moments that are a little bit bigger. So in this, we put together a little task force called the 7100 Experience Team. And so that team is specifically to look at like staff engagement and satisfaction, and then also patient experience. So in order to kind of address the staff, because it's hard to like fill other people's cup when your cup isn't filled, we're going to focus on staff first. And we had a lot of discussions around the high 5 pins and just like a lot of joy that brought people. So we came up with a similar thing. We have seen communication from it and has put out communication. This is currently, it's just called the Rockstar Award. If you have any suggestions on names, we're happily inviting those suggestions. But this will be essentially our version of the high five. For those of you who are here for the high five, you know what I'm talking about. If you're not familiar with that or don't remember with it, no worries. We're just gonna quickly go over what it is. So this is specifically for 7100, but it can be for anyone on 71. So PCTs, RNs, RT, anyone who works here on 7100 is eligible for this award. And it needs to be an action that goes above and beyond. So currently we have that like middle hallway that we like write little thank yous to, like, hey, Tori, thanks for passing my 8 a.m. meds, or thanks for helping me turn, or whatever, which are really great shout outs. This is going to be a little bit elevated. So this is something that like maybe someone spends a little bit more time on a situation that needs a little bit more care. Someone who handles an emergency situation really well. Someone who's like advocating for the team, patient, family, and encourages this collaboration. It'd also be for like great catches and then navigating difficult situations. These are just examples. If you come across a situation where you're like, wow, they did like really good and they really put a lot of thought and effort and time into this type of situation, they're absolutely eligible too. So, so there's that. We will be submitting these via the QR codes, and it's also a link. So you can either scan with your phone and just fill in the text box, or you can like go to the forms online and submit it. Our team meets every month, so we'll review the submissions every month and kind of pick a couple to give out these awards to. Any questions about this? Any thoughts, questions? Like I said, if you're familiar with high five, this is likened to that. If you're not, then this is what you know.
Wow, it seems everybody's super excited about it.
Yeah, I was like, great, okay, great, everyone hates it. Moving on. Okay, the other thing we will be doing is we're gonna be, as you can see, Tori's been picking preceptor awards. So the preceptors will be green, and then a welcome to 7100 for our new hires, they will get orange. So these are things that you can like collect and add to your badge. This was inspired by what Emily Misak did for Nurses Week, and everyone really enjoyed them. So we kind of piggybacked off that idea to have that like tangible item, and then once people start to collect a few, like if they have a few blues, it does like stimulate conversation. You're like, oh, like what are those from? And so there's different methods to collect them. You can either be a precepting or those kind of above and beyond moments, and then obviously the one for coming to our team. Questions? Emily Misak loves it. Love.
Yeah. Thanks for the inspo.
Yes, inspiration by Emily Misak for sure, because it was such a big hit for Nurses Week. So we will treat this kind of similar to high fives. Once they're submitted and we review them, they'll be announced at Huddle. It will be like a whole thing, so people can feel good and feel proud of the work that they're doing and have a little like token of like a good job. What else can I say about this? And again, it can be for anyone, whether someone floats to us, whether it's a resident, a physician, whoever. You can submit that.
I'm gonna make Ron wear this. I'm a minute. Yeah.
Of course.
Okay. Switching gears a little bit, if no one has questions about the recognition award, is SCMS trend. So just wanted to like briefly touch on things that have kind of come through consistently over the past few weeks, just as forms of reminders. Armbands and patient identification. Our patients need to have armbands on at all times. I know we have a lot of it's typically our little babes who the armband is somewhere in the crib or something like that. Please make sure that the armband is on them and it is their armband. I'm not sure if there's anyone wants to talk about any barriers to this. But we've had a few come through where the patient did not have any form of ID band on.
Before, vascular access used to be the auditor for this, and they're doing it again.
Oh,
So that's why we're gonna start seeing an uptick. But also, I think it's just good because it's just another person in there that's helping with this, So, but yes, what are the barriers? Kelly.
I had a couple parents recently who just say like they don't want the armbands on because it like bothered the patient. Some were autistic and then the other one was just like a little baby and they refused it. So I didn't know what to do in that situation. Minus when they went down for a procedure, I'm like, I have to put this on and they were okay with it. But that's one of the barriers I ran into recently, like in the past, I feel like month.
Renee doesn't want any stimulation at night, so she's like, if we have to like do meds that are due overnight, she's like,
Don't even get under like the blanket to scan it.
so that's why it's on.
Is it preference or like sensory needs?
Like mom doesn't want us to do nothing. Yeah. So.
Okay. Okay, great things to bring up. Kids with sensory sensitivities, there is a workflow for those kiddos. I can get the thing, essentially, you create like a, it's not a full binder for it, but there's a process for kids with sensory sensitivities. Yeah. That came out of like the behavioral health kiddos. So if you have a kid like that, I can work with you to get that sorted out. Preference, I think, continue to educate. If you feel like that could be something Brittany, me, or Tori can go into and provide some education on. It just is such a safety thing that, yeah.
I know that what somebody did bring in, Kelly, I don't know if that's the same person, but a parent like outright was refusing and like super passionate about that. And so that's where everybody was documenting, like tried, but parent refused. Right. And so that's why I meant to escalate that to see like, what should we do in that situation?
Yeah.
It was that patient. Okay. That's what I was thinking.
Yeah. No, but those are all great examples. And the one, if they're like definitely refusing, we can for sure look into and see like what alternatives, but I think it's perfect if people are documenting like, provide education.
Yeah.
Trying to what else?
Any other barriers? Leo.
I just feel like a lot of patients really have, especially like our toddlers and everything, have like sensory issues, just like a lot of our patients do. And the soft armbands are great, but they don't make them for our older kids. And I think that's a really big issue when trying to put them on. Same with like the fall bands and like, the allergy ones. I ended up like cutting up like the fall band and trying to attach to a soft armband to keep the armband on because the kids kept ripping them off. And I didn't know if there was a better way we could handle that.
Put it on like a fall restraint, not like a restraint, like a soft limb restraint. Like if you cut off all the ties and everything, like would that still be considered?
No, I cut the holes on where it says like fall precautions, and then I attached it like we would with a normal armband to the soft armband.
You know, like the baby bands?
Yeah.
Okay, yeah.
A couple things, also great point. This hospital is looking into bigger soft armbands with like the baby bands. You can also, in the meantime, put two baby bands together and make one big one. It's not ideal, but you can, and still like put the baby wristband on those. But talking about the fall and allergy for those kiddos is a great point, Cleo. But I don't know the answer to. Anything else? Any other barriers or like trends that you've seen? Okay, the next one that we've kind of seen a few of come through are meds left at bedside. I think this has maybe been exacerbated because of the meds in the med cabinets in the room, which is great. If we're using the med cabinets with locked, then it's okay. But meds that are just like left out, if you leave a Miralax out or you leave a Senna out or something like that, it can't just be at bedside. So just be checking your environment and making sure that like, let's say you bring in Miralax and they want to mix it in the juice, mom wants to mix it, you come back in like an hour or two, see that it's still there, remove the Miralax, and just like indicate that it was not given. We just don't want there to be an assortment of meds that's accessible to the family. What else?
I guess to use the locks.
Yeah, use the locks. Any feedback on the cabinets? I feel like it's like 50-50 if I see them actually locked. I think that you'll always find stuff in there, but not always locked.
I think respiratory meds get left in there more than anything.
Okay.
And that's not always, I feel like it's not always us leaving them in there too. Like if we have
Okay.
respiratory, they're the ones that are leaving the inhalers in the room kind of thing.
And not like putting them into that med bin or like bringing it back.
I feel like most of them put it into like the cabinet. They're just not locking it.
I see. Okay. Okay. Yeah.
With that, if you notice that happening, reach out to one of us too. So that, because it's hard to know, like if it goes through a few people and then someone finds it, then it's like, I don't know if it was RN or RT,
Right.
but then we can give that directed like follow up with RT. So, but that's a good point. There's multiple teams who are going in that cabinet. There's two teams. There's two teams going in that cabinet. There's two. It's actually SRT.
Lots of us. Lots of teams.
There's lots of teams. Lots of so it helps it with just a reminder for us, but then also for RT, so we can figure out maybe they just don't know the combination, maybe they didn't know
That it even existed, right?
right. Any other feedback on the room, the cabinets? Does anyone like the cabinets, not like the cabinets for storing meds?
Also, just a reminder that at discharge, the nurse should be emptying that cabinet and leaving it open for it to be cleaned. Because EBS is not gonna get in the cabinet. PCTs should be responsible for our meds that are left in there. So.
Yes.
Yeah, perfect. Anything else? So just make sure armbands are on your kiddos. If they have any sensory thing, I'll create like a little education on that for kids with sensory needs or sensory sensitivities. But otherwise they should be on the kiddo. And then just make sure no meds are left unsecured at bedside.
Anne, turn it up.
I will say when I had our ed council meeting, they did talk about the armband thing a little bit, about how they're trying. At first, they talked about the idea of having like a handout in the folders for parents to read about the importance of armbands, but then they decided nobody reads from the folders. So then they talked about trying to hopefully get something up on the computer or the TV screen about that, like whenever parents log in or whatever, that would give them like a note about the importance of armbands and how every patient's required to have an armband on. So that's something that they're working on, which might be helpful.
Yeah, that would be really helpful. If that was like the first thing, like to get to the movie section, you had to like get through like intro stuff. Yeah. Well, this one.
And the other thing I noticed too is armband. I just noticed a lot of armbands on computer screens, just like stuck on there still, which is always.
Yeah, Gino has to scrape that off when state comes at
Yeah.
us,
Is
so.
it this- so don't put them on there.
Yeah, I definitely get it from like an ease perspective,
I know.
especially if you have a sleeping kid and you need to just hang a med and it's 2 a.m. I totally get that. I think some other ways, like maybe position the armband like on the ankle or something so that it's something that's a little bit further away. You're not like grabbing their wrist and trying to reposition them. Or, I mean, another alternative, which is a little bit excessive, is you could put 2 on. You could put like 1 on, for like babies, well, I guess for any kid. Like if you put 1 on a leg and a wrist, so then you have multiple access points.
Yeah.
Cool, great. Okay, and then quickly going over, just wanted to touch on some preventable harm stuff that we have going on right now. Okay, regarding CLABSI, so we've been focusing on CLABSI, our CLABSI rate specifically around CHG baths. So thank you to our our CLABSI people who have put together the calendar for our kids with central lines. So I'm sure you've all seen it now during huddle as part of like going around the board. But really just continue to be diligent about kids getting their CHG bath, and if they're not able to get it, documenting or indicating why they haven't gotten it, so that we can continue to increase. But we're actually up a point from the last time we met, which is really great. So it means that either I think it's that we're documenting it more often, but that we're just being more conscientious of it.
And the CHG lotion is now in the supply room, so.
Great.
Oh, can I mention something?
Yes, of course.
This is just random. I just thought about this. A lot of people don't know this, but if a patient is getting a central line, we do have to do a CHG bath prior to that technically. And I don't know how often that's been happening, but just something to let people know.
That's definitely a great call out.
That is a good call, because I don't think people think of that as like something that they should do. So I think that's a really good call out. Carly.
I think whenever, sorry.
Oh, no, go ahead, Kennedy. I didn't know you were done. Sorry, keep going.
I think whenever like Clayton got his, someone did do his overnight. I think it was Emma, so good job. But I just was talking to a lot of people who didn't know that, so.
God. Okay, Carly.
Also, I wanted to mention that some people don't chart right about like why their patient has a central line. Like there's different reasons like why they have central lines. Like it could be like poor access, it could be they're getting high risk meds, stuff like that. But there's a lot of times that people put the same thing, that they're receiving like high risk medications when some of them aren't. So I just want people to make sure they're charting that accurate and like really think about like why they have the central line, and if they don't need it, like advocate for that, like if they don't need it, to get it removed.
A really good call out.
Yeah, today, I had to change Clayton's, because everyone kept putting receiving high-risk meds, which he's not receiving any. He just has poor venous access, so I changed mine today, which I want to talk to them too about why we're not pulling it yet, but I know he's only like a few days out.
Tuesday, we were told it's up to what we're told.
I had
Was it
Clay the other
Monday?
day.
Monday or Tuesday, but
I
it
had
was. Go ahead.
I had Clay the other day and I asked Danny about it, and she said it's because the surgery team or the ortho team or someone like that won't remove it until like their call. And she's like, that's their call, like I can't do anything about it. So I don't know why they want to keep it if he has like a PIV and we're not using it.
No. Agreed.
Cleo.
So the CHG before like a central line. What about like ports? Like Serena. Do we do a bath before she gets accessed?
No.
I don't think so. Because I think you're scrubbing that area so low. I mean, I know that that's the same thing as like putting, like, if you think about it, you feel like it's the same thing as putting in a pick or a central line, but like for a pick or central line, like you're really making a bigger cut almost and like getting more into like you know what I mean? Like into the skin layer. I know I'm not like talking very medical terminology here, but I feel like it's a little bit more than what a port would be.
The port's already in.
Yeah.
Whenever
And then-
I got trained to access, they said we don't need to do that before ports because we're already cleaning like the area really good with the CHG or like other stuff if they're like allergic. So
And then Jen said, do we do CHG baths when patients are going to get an endoscopy? No, because I mean, that's like,
Yeah, I think I always associated with like if they're gonna have any sort of puncture, if there's like an incision or a puncture, then they should get a CHG bath, but like with an endoscopy. That whole thing still, but
It's
yeah.
also like not sterile.
right.
Just what it is.
Yeah. But good
But that is
question.
a good question, and I'm liking that you're even just like thinking out of the box, so thank you.
Okay, great. I think that's all I have.
Okay. I don't know if our liaison or this vaccine person, if when the vaccine's coming on.
I don't.
Have you given it, like, sent out that training yet for those listed?
It should have been sent to you already. Have you not received it? Cute. Okay.
Unless it got within the last couple of hours.
No, it
Oh,
would
you
have
can
been.
add
She.
me, you can add me to that too if you want.
Oh, you know what? One more day. We have one more day to put you on.
Okay.
I will follow up.
Hope you double what's mom's phone is.
Well, wait, you want to ignore her and do your magnet?
Yeah, I will. I already did what I could do, which
Wait,
was,
quick question
it's
before.
prepared
wait,
for
sorry,
phone
sorry,
tag.
guys.
Yeah.
We have a few people who are doing the flu shot liaison for staff. Has anyone gotten the training for it yet?
I don't think so.
Weird, okay.
Well, I did mine on like Saba. We got like an email about it.
Yes. Wait, so Jen, you did get it?
Yeah, like an email, and then I think you're supposed to like look something up on Saba and do the training.
Yes. Okay. So Jen, yes. Hannah, Emily Brown.
When would we have gotten this? Jen, do you know if you got it?
Gave a thumbs up.
Okay. Because the training is it's literally a slideshow that essentially teaches you how to give an IM. And so it's not an extensive training. It's
Yeah, I know, I went back pretty far. I don't see anything that's telling me to look up the.
okay. Perfect. Lexi K, you're on. Did Lexi K say she did have it?
Yeah.
Okay.
Thumbs up.
Okay. If you reached out to me saying you did want to do it and have not gotten the email to do the training, can you please email me or text me? I'll remember yours.
Okay, Steph, take it away.
All right, guys, Magnet starts Monday.
Thank
Woo!
God.
Okay, so there's a couple of asks. I don't know who's on right now that's on what shifts, but ask for people who are working Sunday night is that they want some night shifters to help celebrate. Reading the surveyors will have friendship bracelets made out of pool noodles and some Taylor Swift music playing, and the first floor entrance is where they're going to be coming through. That has literally been closed for the last 5 years, so that's going to be fun. So anybody who's working Sunday night, if you are able and would like to help greet them, that would be great. Otherwise, everyone working Monday, I'll be sending you an email when I have a moment today. Just with some of the things, the one thing that we do have, if anyone's on right now that is working Monday, they would really like a designated greeter to greet the surveyor when they come on unit.
And it can't be me, even though I think
And
I'd
it
be the
can
one-
also
I'd be
not
the
be
one
me,
doing it.
even though I will be with the, well, not surveyor, with the appraiser. I will be with her officially confirmed.
Oh, good.
Are you here Monday? You'll do it. You'll
Yeah.
have an appraiser.
Oh, 70 goodies today.
We will have goodies for them. So
We have
it will-
goodies.
Yes, and so we know the time that we'll be coming down here. And so that's already all on the schedule. So we'll make sure that you're right at the front of the unit to
And then you
say,
got yourself out of like,
Well,
I think that should be
hello.
an excuse to then not pull Joe into the middle. and to chat with them.
But I think that is the expectation.
Oh.
You can just say like, this is 7100, so the expectation
Joe's like, I'm done.
The trainer is to say, hi, this is 7100, we are a 16 bed unit, this is the population that we serve. And then any immediate questions she has, and just, nice conversation and say, let me lead you to our boards. But I will also be there. This is the one, this is the only one that I'm actually allowed to participate in. All the others, I'm like, see you in 30 minutes.
The meet and greet on the first floor is at 7:40.
I couldn't find the schedule today.
I
They're
thought it was
still,
7:40.
they were still finalizing the schedule when I had a meeting yesterday.
I don't know where we still.
Also, like, my role has changed,
Yeah.
the timing that I'm expected to be here has changed every day, so they're still fine tuning the schedule. Once we have it, I can send it your way.
Okay.
But,
The other thing is too, we'll be reaching out Cleo and who else is the morning breakfast? Aaliyah. We will be reaching out to the nurse that they will be getting report to for that morning, on Tuesday morning and then Wednesday morning, because they have to leave the unit by 7:15 to make it to the MCC by 7:30 to then get their breakfast and be sitting down. So that might be something that we'll try to coordinate. And then we also ask for those 2 days for the PCTs that are here and on the unit to be helping out, or especially on Monday, help out in like with patients, because we'll have about 4 or 5 nurses talking to the surveyors whenever they come. So that would be a really great team effort.
and her name is Susan. She can choose to talk to anybody. So she may also want to talk to the PCTs to ask like, how do you partner with? So this is a unit especially, I think that, she will very quickly see that what is great about working here and why do people stay. The vast majority of those hearts say teamwork. So I have a feeling we may have some questions coming that ask about teamwork. So, which are things that we can all speak to. Like, we all know that we're a great team. They have done a fabulous job. Tori, Alex, and Britt putting together all of the things that we need to know on that board. So anyone working Monday, I think, weren't you going to just like
Yes.
point out where things are so you know where they're at? But everything is like beautifully laminated, up-to-date info, way more updated than my unit scrapbook that they've been sent, because I made that last October. So I was able to edit it in May, so I was able to update the leadership team. But there were a lot of things that have happened since May that are really important for us to share. The one thing they do ask is if the surveyor asks anyone we tell them about cool projects, if they ask for any documents, you can give them to me and I can bring them to the command center, because they actually have to go through them so we can get them appropriately uploaded. So you can say, absolutely, however, we're going to give them to your guide so we can go through the appropriate channels so we can get it uploaded into the system. Just say, unfortunately, I cannot hand it to you about new stuff, which she should know, so.
I'm excited. I think that this is gonna be great, and it's nice. They're only coming for like 30 minutes on our unit that we really have to worry about. So it's not like joint or, state where we're like
So
every
great.
day, like nervous about it. But my one ask is that, we're gonna try tomorrow, I'm gonna try to do like a good clean of the unit. This weekend, if whoever's working, if you can just take some responsibility in keeping the unit, tidy so that it's not so much for us to do. Or even EBS and all of that, Monday morning. So we, if you can help, that would be awesome.
Yes, I will, and people that are here Monday, I'm gonna send you all the link that takes you to the SharePoint site where the document lives, so we can see all of our data, but you guys have printed out most of the things that pertain to us, and we really didn't have any examples, specific, like exemplars that were written about 7100. However, there were some projects that people that are important to 7100 participated in over the last 5 years. So I may list those out when I send them in the email, that you can say, although like you weren't on this unit at the time with all the civility stuff and the stuff with all the computers, whatever that was called again, when everything with Microsoft crashed. The main person featured in that is Amanda. Yes.
Oh.
Because she was the MOD on for whatever, she was the
Awesome.
or whatever, AO, or whatever.
That was terrible.
Whoever she partnered with, yeah, I got them
You were-
too.
any
leadership that was on
question-
call that came in at she came in at 3 a.m. So they did that exemplar and then some of the other things that I know that Joe worked on with the changes that we made to Epic with the things that we charted. So anything that lists any of our people, I'll include in it. However, we did not specifically have any exemplars written about our unit. So you don't have to
Challenge
know
for
that.
next one. There we go.
Heidi's already got some of the things that she wants to include in the next one. So,
Yeah.
but she'll be retired by then. So we'll see if Lindsay will still want those examples.
So funny. Hi.
But-
For a second.
Oh, you're so funny. Okay, great. Any questions about Magnet?
Oh, also, anyone who's working Monday or Tuesday or Wednesday, the theme is obviously in our Magnet era. If you
Oh,
want
yeah.
to dress in your favorite Taylor Swift era, if you are in fact a Swiftie, please do.
We'll wear something that sparkles, saying that. I'll just leave it at that. Okay.
Rather than forwarding the entire email that I forwarded to you, that was actually targeted specifically mostly at admin soups to get people to come Sunday night.
Yeah.
It was, or Monday morning from Sunday night. Yeah. Just like your favorite era.
There we go. Okay, cool. Okay. And
Yes. Hi guys. The SSR is still a thing. We have not been doing as well with I think for the most part, Brittany and I agreed that we see people in the rooms. We see everybody doing their 360 and 60. I think the one thing we wanted to talk about is just making sure that it continues to get documented, that you're giving yourself credit for it. And then also just with the armband thing and some pressure injuries and stuff that Brittany had mentioned, just making sure that our 360 and 60 is a full 360 and 60. So we should be checking armbands, we should be checking for fall bands, all of that kind of stuff. And then please making sure that we document it, because even if other units are falling short and maybe not everybody's doing as well, it's really not, obviously we're competitive, but it's also just the right thing to do and the best thing to do for our patients. So just want to put a little tag out there again that we're still trying to emphasize doing your report well and your 360 and 60 and documenting it and all the things. So, and thank you to everybody who has been doing any type of audits on them and all the things.
yeah, I think if anything, whenever we walk by during report and you can see you guys in the room, and I think that it's been the last 2 weeks I've been hearing people talking with family of oh yeah, this is Emily, she's gonna be your nurse today, and I was just feel a great sense of just joy and happy that I know that you guys are still doing it. You're doing what's right and including the families. And I think that we can just continue to see that whenever we're doing our leader rounds. So thank you, and give yourself some credit. We're going to continue every staff meeting to talk about the SSR. It's never going away, because I do think that I personally see the big importance behind it. And I know that you all do too. So let's just make this an important part of our workflow.
And just one other thing too, making sure that we're putting our names on the whiteboards and using them as much as possible. I know sometimes a lot of kids don't have a lot of stuff to write on or whatever, but I will say, I don't think Megan's on, but shout out to Megan. She made an amazing whiteboard for Clay Baby when he came back from his surgery. And I know that his mom was super appreciative and loved that touch and just how personalized it was for him. So just making sure that we're using our whiteboards, but especially putting our names on the whiteboards, because that's a part of our safety checks.
Shout out to Christian. Whenever she's here, she updates all of her boards.
That's awesome.
That's how I know for a fact that those are updated. They name and theirs current. So
I love that.
perfect. It's been a chill meeting, but shout out.
Yeah, no, I don't.
I gave her a shout out the last time we worked together. So I don't even know look. I know they're updated.
Okay, educator updates.
Perfect. So just a few things. I'm just gonna touch on RQI days first, just because those are short. Continue to be monitoring your SABA for when your RQI stuff is due. Some people were a little confused because their SABA said that they were due this quarter when they have done it in the recent months. Unfortunately, at random, some people were chosen to be early adapters. And I'm so sorry, I've reached out to the RQI, like leaders in the hospital, and basically if your SABA says it's due September 30th, you have to do it by September 30th. I've already sent emails to those people, so you also continue to check your emails.
I even got an email.
Did I send you an email?
Yeah. And I got that. You should be holding me accountable.
Good,
You.
good. So, yes, just be checking your emails, and your SABA. Also going off, checking emails, Ed days, we had our first Ed day last
It
week.
was so good.
It turned out so good,
The small but mighty.
thanks to,
We
yes.
really bitched about it.
Yes.
So good though.
No, it turned out so good. I think everybody really appreciated it and learned a lot. It's very interactive, but I will be sending emails like the beginning of the week of the week of your Ed day. So if you have Ed days tomorrow, you should have gotten an email on Monday or Tuesday, just about like location and all that, because that is not in SABA because it's a bit wonky. So thank you for everyone who was very active in participation, and the first one went really well. So look forward to it if you haven't gone yet. And then Baxter pumps. So we've kind of touched on Baxter pumps for a year now, but it's finally coming back. We are going to start scheduling classes because it will be included in this next big schedule coming up. So we just want you guys to have time to schedule yourself. So the pump training classes will be January 12th through the 26th. So you guys have, I'm going to send out an email today with like instructions and reminders. I'll also put it in the Friday updates, but you'll have until the 28th, so 10 days to sign up for a class yourself. After that, they have asked that the educators just sign people up for classes. So if you do not sign up yourself by the 28th for a class, then I will just go through and assign you a class that is open. Because we just really want to get everybody registered as soon as possible for when this 12-week schedule period opens. So I'll send out an email with all this information, but you have until the 28th to self-enroll. If not, I will enroll for you. If you're a super user, you will already know that. I sent out an email a few weeks ago just reminding everyone who is a super user, your class is a little different. So I'll email you guys about which class you guys need to sign up for. And then as we get closer, probably to the end of the year, we will get some information on pre-work that will be assigned. And the pre-work must be done before you can take the in-person class, much like CPI. So that's not like linked to the class in SABA yet. From what I'm reading, it will come out at a later date, and then we will assign that. So just an update, it's actually coming. It's here now. We will do the Baxter pump training first, and then after that comes the Epic integration training. But we're going to start with just getting everyone enrolled in the pump class. So I'll send out an email with instructions, but you have 10 days to self-enroll, or I will enroll for you.
We understand too, obviously this is hard because for the people who have already done the pump training, this just feels like another, and then adding on the pump integration, it's a lot in January and February, including with then surge and everything else going on. So we recognize that, and we are sorry. We are going to also try to manage where then there's nothing else that's coming your guys' way that we can control that's like from us internal here. Obviously the house is going to want to do what they want to do, but I know a lot of people are being very purposeful and remembering like this is pump update, like we got to just nothing else for the nurses, because it's a lot of education. So
yes.
Yeah.
Jen, if once you guys self-enroll, please email me what class you signed up for so I can put it in your My Time.
And so then that Hannah doesn't put you
yes.
on that date for the schedule, because that schedule will open up on Monday.
That's a great call. That's for any class. If you ever sign up for anything, please let me know so I can put it in your My Time to get paid, and we know why you're clocking in and out. Also it is going to be the same syringe pump. And I know we already got training on that, but it has been a year since any of us have seen those. So it'll be a good refresher. And then the large volume pump is different than the one that we got trained on. So it'll be brand new information.
Cool. Any questions about all of that?
I don't think there's available.
Yeah.
Lovely. Okay, I'm gonna hand it over to Jen to talk about nursing participation in rounds.
Yeah. So we are working on a new initiative, as you guys saw in the last updates that Alex sent out, and we're working on improving nursing participation in rounds. And we're doing this by first identifying the best way that we can notify bedside nurses when their nursing round is like starting on their patient. So right now we're trialing the Epic chat, and then the following week we'll be trialing the Vocera. And then from there we're going to gather data and just see which one's working best. And then the second thing we're working on is finding a consistent start time for rounds so that it helps the nurse plan some sort of time around their patient care to be able to attend the rounds. And I know Brittany's working on this, and we're going to hear more about like an actual start time for this. And then just the actual like path that rounds will follow, which might be like seeing high acuity patients first, but we're going to hear more on that as well. And then we understand that the mornings are busy for bedside nurses. So we're trying to prioritize just nurses being present. So Brittany's also kind of trying to work on seeing what resources we have available to support nurse attendance and also providing good patient care at the same time. And then another thing we're working on also is just being able to update the nurse in real time about like changes or any important updates that might be really important to the patient care throughout the day. And then just updating in a timely fashion so that patient care is not delayed in any way. And then what are the benefits of nursing and morning rounds? So one of them is understanding why orders, why there is a particular order. I'm sure sometimes in report communication gets lost and we're like, well, this change was made, but we don't really understand why. So this is where also we can find missing pieces from report. And then also just performing new orders, like we said, with the proper knowledge on a timely basis. And then also participating in learning and just education opportunities during actual rounds with the attending and everyone there. And then it also helps with parent partnership and communication. And it also just gives the nurse, I think, a voice when you're in rounds and parents are there so you can communicate with them on any changes or updates that you have as well. Yeah.
Yeah, thanks. I think I just want you guys all to know too that all the information that was gathered here came from, thank you so much for everybody who filled out the forms out on the boards, of the direct conversations that I've been having with people, picking their brains about it. So this really all has stemmed from you guys and what you believed of what the benefits were for attending in morning rounds, and then also like the different processes that need to be improved on in order for you to attend the rounds. So I really appreciate it, and I think this is one big example of how your voice matters and works in changing and helping in the workflow and whatnot. So thank you. I think Kennedy said something, and I can't see my chat.
Kennedy said, I don't know if this is best practice, but maybe if you have a patient with a ton of meds that need to be crushed, the previous shift can prepare those meds for day shift to help with time management in the morning to attend rounds. I was never the nurse that liked that, but I have like wild anxiety, so.
Do you?
Yeah, I mean, just a little bit. I believe I'm medicated.
My worries, you don't know exactly what was like put, like crushed.
Yeah, like
I love the idea behind
sure.
it and like the helping in it totally. And if you are comfortable with that, then I think that's fine. That's just my only anxiety with it is not knowing for sure that that was the medication.
Yeah. And sometimes like I don't I'm sure there's not many meds, but like how long it can be sitting once it's been crushed and like in the solution.
Yeah.
It's more so for the crushed meds.
Yeah.
But yeah, so I think that I don't think it's wrong, but
Great question. Anyone else? We appreciate your guys' participation in this. Jen, Anne, and Megan, you guys are awesome, and thanks so much for helping with this. More to come.
First 2 days on break.
Yeah, I have seen, just walking around, I've seen so many nurses in rounds
Yeah,
the past week.
it's so
It's
great.
been going good.
Okay, so I'd love to give monthly updates on this. So our advanced respiratory care unit, just a reminder, we're not a step down unit. It will be an advanced respiratory care unit. As days have started, we are learning, we are thriving. I actually want to tell you, I did hear, I was talking with Ron the other day, and a big compliment came from him to you guys of, he could just already see the level that you guys, and I know like, obviously most of you have not even attended Ed Days, but just the gratitude of how much you guys have been growing in these last 8 months. He was like, I feel like, and it could be timing and knock on wood, I know we've had like 5 rapid responses since I've like last talked to him, but he's like, in the way that these rapids are going, how nurses are communicating any type of issues or differences in our patients' clinical status. He's like, I just can see that they all are so invested and really grasping on trying to learn and do more. And he's just been super appreciative of you all. So thank you guys. I just felt like that was a huge compliment coming from Ron and all that he's already seen from you all in that. But I just want to give out a reminder. So this is going to go, my one ask for him was that I don't want you guys to get this education and then we not use it for 4 months, 5 months. I don't think that that's right. And then plus with pump integration, I was just like, we need to just do it now. So in the middle of October, we're not going to do we're just going to start keeping patients here that could potentially like are if we have to increase settings and aren't in a complete respiratory failure and more in like a respiratory distress, then we'll keep them on the floor. As we talked in the last staff meeting, RT is ready to go and upping their staffing too and like adjusting assignments appropriately if they have somebody who needs like Q2 treatments and whatnot for this type of therapy. And then if a patient comes to the EU and is not on their regular settings, but on more of like a 6 settings or higher settings, they will still go to the PICU to be stabilized. And whether that's 8 hours, 12 hours later, they can come out to us. And Ron said it like ideal world, it's like not for 24 hours, but if it's someone who like we know we can take and it might vary, they can come a little bit sooner. So I just want you all to know that like, I really think that this is going to be a few patients. I mean, we'll learn, right? We're going to learn and see. But I think we're already doing this, to be honest. Like I've seen this, like even the rapid that just happened on bed 7, like we've already increased their settings, upped their O's, and like we're trying to do their treatments. Quincy's, aren't you the nurse? And oh, I was like, I felt like yours. Yeah, Vanessa's. And so like I feel like they've already tried in starting a lot of this, and we're becoming a lot more comfortable with it. So I think the conversation around these patients, if we're not feeling that comfort level, let's discuss why and what's making us nervous in this situation. So I think all is going well, and we're going to kind of see how it goes.
What has been communicated to the PICU?
Yeah, so I have been in talks with, obviously, I tell their leadership team, and then Ron has been in communication with their medical director, Kaylee. This actually was really part of Julie and his partnership and how to alleviate from the PICU.
I just know recently in the last couple of weeks, I have heard the pushback from the PICU when we're trying to send kids back to them who are on escalated settings. Well, what can you do? And it's just the tone. So just FYI.
Yeah. If you could just send me, if you happen to get a name or whatever, but like, I just think that that's where
I did not. I just happened to be
around for that.
Around for it. Well, she put it on speaker and said, well, I'm the charge nurse here. I said, what can you do? It's just really the tone.
Yeah, that's a little frustrating.
Yeah. And it's about like escalated high flow stuff.
Think that I will say, I learned so much, obviously being down here, and I think that that's just a knowledge gap and them understanding that it is significant when we go up on our O's, even if we're on high flow on a kid who's on his stable settings of high flow. And that can mean that he's, for some reason, needing more oxygen and could potentially need to go up more on his high flow. And that's something we don't do. So that's one of the things that we don't, we do many things.
Correct.
We will, yes, okay.
As long as.
Yeah, you have to let's just have good conversations with each other, but also let me know.
Sounds great.
I'll go chit chat. Cool. Okay, last minute thoughts here. I want you guys to know search season is kind of here. We're getting there in the winter months. I want to remind you guys, I think what we did tremendously towards the end of search season last year was we got a lot of documentation for 7400, and we made a lot of changes. And I think it's hard for us to see the effect of that because search season had ended. And I think that's where the world was like, oh yeah, that worked. So I want to remind you guys of the things that we did do. We were able to alter the staffing grid of 7400 so that we can have more support and not be so down nurses whenever we were going between, specific patient numbers. And we were able to communicate more to admin soup as to why it's important for at least one of our charge nurses to be free of an assignment. I'm not going to say that's a guarantee every time, as we know search can stretch our resources, but I think we are working on what other resources can we use when we don't have that opportunity. But it should at least one charge nurse be free 99% of the time. So having more of those conversations with admin soup has already happened and I think has made a difference. And then also too, I think I came from just obviously I had a different environment during search season, and to see it end the way that you guys had come together, the teamwork. I know we keep constantly talking about this, but you all work so well. I know it doesn't feel like it, but you all work very well in a very stressful environment like that. And I think that's really what kept me so intrigued and being like, yeah, you know what? I signed on to the right unit. These nurses are awesome. These techs are awesome. The teamwork and how you two, the groups just help each other out is so great. And I think that that's just what's going to set us up for success in search season. So just remember those things. But I want to know, with that being said, is that I ideally love to think that is still going to work, is our new grids, our new thought processes, being able, we are going to have to alter things, and we're going to need flexibility from everyone if we're starting to accept more patients that are needing 2-to-1 assignments because of therapies and treatments and whatever happening on 7100. Assignments might get changed frequently throughout the shift, and that's going to be hard. But just know we're learning from every opportunity, and as long as we can have conversations about it and learn what went well and what didn't, I think it's just going to set us up for success in the future. So let's all learn together, keep that open communication as we do so best, and just hope. And actually, no, I don't have to hope. I know that all the things that we put in place last year is going to, I mean, whatever is this year, but you know what I mean? It's going to do us well. So that's all I got.
The admin soups really like us.
Do they?
It doesn't feel like it,
Oh,
but they
do.
like
That
us.
was a question.
Yes, no, they do. They really like, I've gotten feedback. They like that we're all flexible.
Yes, they say,
I've heard that too. Thank you for being so flexible.
And they're like,
Thank you for
yes.
taking this patient. Thank you for flexing.
And they're like
so
afraid,
you
and they're
didn't
like,
down or whatever.
almost like prepared for us to yell at them.
Yeah.
And they're like, sure, whatever. And they're like, thank you.
I think with that, I've had some more collaboration with the towers, with Kara specifically for 10-100 and 11-100, just to kind of piece through of how did she work during surge with the 16-bed unit and advocate to admin soup of when you guys all hear that our charge nurses have assignments, but yet 12 doesn't have an assignment or 10 doesn't have an assignment or whatever the case might be in the resources that are being allocated. I think it's a great conversation and learning of how our towers are so different from those units because they are so big that if you could imagine, they really do need that one charge to be free for I mean, 12's so big, and you guys have been up there and you've had to work it and whatnot.
Only like when I trained Tori for charge, and we had all three
yeah.
patients between both units.
Yes.
Like there was no way we could have had an assignment.
No, there's no way.
There's no way.
No, and so I just think that that's just little pieces of reminders, but I don't think that that should stop the conversation, and just reminding Evan Soup that even though we have different acuity or like different staffing grids than the rest of the house, it's there for a reason, and I think that's going to be utilized even more as we as we keep going into our new unit. So I do agree. I think the partnership with Evan Soup, and that's because of you guys and how great you all are. So you should give yourselves a big pat on the back for that.
Go team.
Go team, Vanessa, go team. Welcome. Read it, girl. Okay. Let us know if you. Oh, wait, I had one last. I forgot I had all these notes here, and now you're gonna see it. You like how I have to remind myself of all my great pep talks and stuff. I'll just do that. Okay, so just remember to with surge, extra shifts come, and PCTs. You guys have had tons of extra shifts and availability of picking up. Take time for you. It's hard. It's that crazy winter season where depression comes out. Just take time for you, okay? So the money's great, and obviously I want you guys to pick up, but you got to take care of you. So let us know if you need help with that. That's all I got. Great.
Well, sorry to the weaknesses that I just said. I'm just gonna see what you're eating. I'm on.